Minnesotans have access to marijuana? That's the question state lawmakers are trying to answer with two proposals.
One, which I covered last night, would make adult recreational use of the drug legal.
Another would expand Minnesota's medical marijuana program. KIMT News 3's Anthony Monzon joining us live with a closer look at that proposal.
Well, Katie and George, behind me is just one location where qualified Minnesota residents can already come to pick up legalized medical marijuana. And looking ahead, there may be more patients in their ranks, and that's because of these two companion bills that are looking to add opiate addiction as a qualifying condition for the state's medical marijuana program. Now, lawmakers are set to review those bills as we speak, but today I spoke with the director of Minnesota's Office of Medical Cannabis, Chris Thokus. She tells me right now there is very little research on treating opiate addiction with medical cannabis, and existing research is inconclusive. However, Thokus says in surveys her office has collected, healthcare providers who work with the program report over 60% of their patients with intractable pain have reduced their opioid use. Similarly, over 60% of patients who were using opioids when they first registered for the program say they've reduced or eliminated their opioid use after 6 months. Director Thokus says that information doesn't necessarily amount to a clinical study, but it does suggest cannabis might be helpful.
I think that there is some hope there. I just think that there isn't quite the robust research body of evidence for opioid use disorder that some folks might want to see.
And Director Thokus says that lack of evidence isn't just limited to this topic. She says research on therapeutic uses of cannabis as a whole are limited because of its designation as a Schedule I substance federally. Live in Rochester, Anthony Monzon, KIMT News 3.
Thanks, Anthony.
Now, right now, both bills to make opiate addiction a qualifying condition for medical cannabis are set to be reviewed by committees in the House and Senate, respectively.